85,000 employees and almost as many contract employees. 11 billion annual IT budget. Healthcare information on more than a third of all Americans. Jose Arrieta is Chief Information Officer for the federal government's largest civilian agency. Artificial intelligence and advanced analytics, blockchain, and 5F. Arrieta incorporates the most advanced technologies to address the many technology-driven missions of the Department of Health and Human Services. Smart, creative, and hands-on, Arrieta is passionate about making a difference, and he is making one at HHS. Dominic Cussatt is Principal Deputy CIO for the world's largest healthcare provider. His customers are American veterans, and he is spearheading technology initiatives that make their healthcare better. Top of the list is the integration of the many facets of healthcare delivery into the largest electronic health records management system ever attempted. Former Chief Information Security Officer for the Department of Defense, Dominic works collaboratively to break down stovepipes and provide comprehensive and the highest quality healthcare to America's servicemen and women, from active duty to retired. From Senior Network Engineer to Chief Technology Officer, Jaspal Sagoo has invested 30 years in support of the Centers for Disease Control's primary mission to protect Americans from infectious disease, prevent their transmission, and educate them on their prevention and remedy. He's an innovator making a difference, not only within the CDC, but across the many missions of the Department of Health and Human Services, to include his chairmanship of the HHS Cloud Computing Advisory Council.
He doesn't get an introduction.
The voice. All right, good afternoon and welcome to the final panel of today. And I understand that we are all that is between the crowd and Skunk Baxter. So as we prepared for this panel, I was amazed at your diverse experience and what you deliver to the audience today. 64 years of public sector experience in the technology and acquisition fields. And then when you put the private sector experience on that, you three gentlemen deliver 94 years of experience to this room. And quite frankly, you look a lot younger than that 94 years. So Jose, you're at an organization that is responsible for the health of all Americans, and that's over 340 million people. Can you share with us what you're doing at HHS that's exciting, new, innovative, and transformational?
Yeah, I mean, I think so. When you think about HHS, we touch 1/3 of every American's data. So one of the things we're doing is, from a TIC perspective, from a cybersecurity perspective, we built a machine learning wrapper around our network. The total amount of data that hits our network every day is about 2,000 times the total number of pages in the U.S. Library of Congress. And so what we've actually built is a machine learning wrap that insulates us from different types of attacks and actually allows our incident responders to focus in on maybe the 19 or 20 different incidents that are the highest risk. So that's an example, and I'll give you a couple other examples, but that's an example of how we're trying to use machine learning, recurrent neural networks, which is a more advanced form of artificial intelligence, to actually eliminate some of the monotonous functions that are performed by the workforce so they can focus on more critical thinking skills. We've also, over the summer, built 2 recurrent neural networks. We're actually going to apply one of them to prescription drug claim data, and we're going to use that coupled with social determinants of health to start to identify and target policies in terms of how are they impacting the opioid crisis. But where we started was in the acquisition function. And so what we're doing is we're using natural language processing to actually read through contract files and identify price points. And then we're clustering them so that we can get an understanding of the lowest and highest price, average price. We can actually drill down into the documents themselves. We're aggregating that data. It's about 10 terabytes of data over 15 years. We're aggregating it up, and we're using it to actually go and execute strategic sourcing, category management type buys. We actually just completed one this morning, and I've been on the phone almost all morning working on the final pieces of it. I won't tell you the company. It was an easier company to deal with, but using that data set, we were able to negotiate between 33, and we're still working out some of the details, but between 33 and $40 million in savings to the federal government over a 5-year period of time. We're also able to significantly lower the cost for the industry partner to actually do business with the U.S. federal government, because we created a single artery for ordering, which creates a lot of visibility for them and allows them to put more of a focus on their mission, on supporting our mission, versus actually trying to win work. So just a couple of examples of what we're trying to do by leveraging our cloud infrastructure and leveraging an integrated approach to sharing data across multiple cloud platforms to automate some of our business processes and then use data so that we can make more strategic decisions and hopefully save money for the American taxpayer.
All right. Dominic, as a veteran, I'm glad you're here.
Glad to be here.
And I think that everybody in the audience, we have several that are veterans. The audience either knows somebody that is a veteran or has a family member that's a veteran. And you're part of the largest healthcare organization on the globe. So could you share with us what innovative things that you're doing, exciting things that you're doing for veterans?
Sure. Thank you. Glad to be here. Yeah, we can all empathize with our customer base. A lot of you are veterans, or you're related to a veteran, or you're friends with a veteran. So we all empathize with that community, and it's a huge community. So very proud to be part of an organization that's here to help them. I always say that's one thing I never have to do, is motivate anyone on my staff about the mission. They're there, and they stay there. So Jim Jaffer, our CIO, was up here a little while ago, and he kind of shared with you the numbers, so I won't go over those again in detail. But VA is a pretty massive organization, and we not only have the 20 million veterans that we can support that Jim mentioned, but we also have our other constituency is our 400,000, it's nearly 400,000 person workforce, government workforce that works for the VA. As a result of that constituency, we have massive troves of data. And not only do we have those two constituencies, I think by law we have to keep veteran data for 70 years. So this is not data that we can, purge out or, archive out. I mean, we have to keep records of this. So it's not only a huge responsibility and a pretty daunting task to array all of this data, but it's also an amazing opportunity. And one of the things I am really pushing for is, knowing that all that data is there, how can we get data? And I think all of us in government can think like this. How can we get the citizens' data working for them? How can we make their lives better by using the data that we house and we are the stewards of for them? So, with all of the advancements in AI and data technology and analytic technology, predictive analytics, supercomputing technologies, we have a lot of great opportunities to enhance our citizenry's lives. And like a lot of agencies, we don't have enough people or enough resources to service the veterans the way that we'd like and the way that U.S. citizens would like. So we need force multipliers anytime we can get them. So I wanted to share with you some of the AI projects we have going on that's tapping into this huge data lake of data that VA has. You may have heard about the Million Veteran Program. So that's a program we've been running for a few years now. We're at about 800,000 veterans. I would imagine perhaps some of you are part of it, where veterans voluntarily allow their genomic data to be used for research and analytics. And what we're doing is using that genomic data to learn how genes, lifestyle, military exposures affect the health and lifestyle of veterans who have been out in the field. So very excited about the possibilities for that. We do a lot of research at VA. We talked a little earlier today about interagency partnerships. We do a lot with the Department of Energy. We use their research facilities and their labs and their supercomputing capabilities. So that gives us the ability, that partnership, to get something out of this data. Another one I want to mention, please bear with me through a pretty contorted acronym here, the Stratification Tool for Opioid Risk Mitigation, but it's STORM. So that's pretty cool sounding. So I think that was worth the journey. So STORM is a predictive model and web-based dashboard that helps our clinicians identify patients with an opioid prescription who are also at high risk for serious adverse events, such as an overdose or suicide. So you've heard a few conversations today about the opioid crisis. This is one of those things I see. How can we improve the lives of our veterans, let their data work for them? We use the markers that are in their records to help us provide some extra care and caution to them when we're prescribing them the opioids that they need to live a happy life and to relieve them of their pain. Another program that we've begun is we've partnered with an outfit called DeepMind, and we formed a partnership to address the global issue of patient deterioration during hospital care, which this was a surprise to me, accounts for about 11% of the in-hospital deaths around the world. So this partnership looks at analyzing patterns from about 700,000 historical depersonalized health records, so we anonymize them, to develop machine learning algorithms that will accurately identify risk factors for patient deterioration and predict its onset. So these things are very powerful for us. It's really elaborating on what our clinicians can do if they have data and the power of data and AI and analytics to make, to be a force multiplier for their skills. It can be very compelling, and we can save lives and make folks' lives just better for the long haul. So those are just a few of the things at the VA.
It's excellent, certainly a storm. So Centers for Disease Control. We could talk to you for days about what you do to protect Americans and, for that matter, communities around the world. What kind of innovative things are you doing at CDC?
So the CDC footprint is not only domestic, but we're also in 50 countries. And we take for granted the connectivity in the US. What we don't often realize is that when we're operating in these ACONUS countries, a lot of the time the infrastructure is totally missing. And so part of our mission is that when we could get called in, either ground zero in the US or by the Ministry of Health from these countries, we have to quickly ascertain that capability. Now, starting with the US, normally when we get to ground zero, we can quickly set up communications and the capacity is there, either from state or local health offices. But even there, it's really about the speed of delivery. So when our epidemiologists make the initial determination and collect samples, the quicker we can get those samples analyzed and the data returned to the epidemiologists, the more lives we can save. And to that end, we're using all kinds of technologies. We're enabling and empowering the EPIs in the field with not only personal supercomputers that are in magnitude much more powerful with GPUs and multi-core processors, but we're also, one of our biggest hurdles was that when you take a pathogen sample, the time to get that sample back to CDC and have the big home genome sequences do the initial dump and analysis, that lag and the latency was really problematic. So about 4 years ago, and this is just one example, we started working with a British company, Oxford Nanopore, and we now equip our EPIs with $1,000 sequences on a stick. And these are essentially thumb drives that they can plug into the laptop and do the initial analysis, release a rudimentary analysis in the field without having to traverse back to CDC headquarters. Now, we're fighting Ebola right now in the DRC, Dominican Republic, and last year there was approximately 2,200 deaths last year. And using just this one particular technology has really enabled the epidemiologists to do analysis there in the field and contain a lot of the infections and keep it in their host country. Another one is that we do a lot of sentinel surveillance in these countries too, and our ability to deploy expensive sensors inhibited us from really deploying them where they were needed. It was a manual process where we were having to send out an API or an employee from that country and bring it back. So we've been working with our global health APIs to equip them with sensors. So we've been deploying a lot of inexpensive sensors that these are environmental sensors to deploy in the hundreds so that even the aggregate data, although it's low fidelity, when you combine it, is good enough. And we can leave them in place and have a very low bit backhaul reporting the data to, in this case, we're using Amazon's edge devices and IoT servers. The whole premise here is that if you can cut down the round trip and cut down the latency and also empower the epidemiologists and the physicians in the field, they can quickly do their work and only traverse large data sets back to the US mainland when it's necessary. This is why yesterday's panel, when we were doing the 5G discussion, it'll be of paramount importance because as these sequences get smaller, their payloads are getting bigger. And these large data dumps, especially genetic or pathogen data dumps, unless you have a good terrestrial link or a good satellite link, which we don't in some of these countries, 5G has the potential to really revolutionize how we do epidemiology.
Okay. Jose, we were talking about public health care from a national strategic perspective and cyber attack. From the artificial intelligence technology that's available today and the things that you're working on, could you talk a little bit about that threat?
Yeah, it's interesting. I spent a lot of time at the Treasury, and a lot of banking institutions around the world experienced large attacks, whether they be DDoS attacks or other. The banking sector, if you're an international adversary, is probably not the place that you want to attack, because most of your allies, even if you are an adversary of the United States, rely on the U.S. banking institutions at some level. But if you think about the health sector, and in particular what keeps me up at night is the health sector in and of itself is not as intertwined with the global marketplace internationally. The $1 trillion in payments that are executed, I mean, we have a $1.45 trillion hit on U.S. GDP, $1 trillion of which are payments by CMS. With 10% impact on U.S. GDP, I think DoD's in the 7% range. I mean, it's a big entity. Most of our work, and some of it's international, is based in the United States. So if you wanted to have an impact from a cyber perspective, that it would negatively impact the U.S. population's trust in its government, trust in its government's ability to deliver solutions and services, and you didn't want to have the ripple effect internationally, you would focus on the U.S. healthcare sector and the $1 trillion in claims that are executed every year in the United States. And that in particular is what keeps me up at night. So a couple of the things that we've done is I talked a little bit about using machine learning capabilities to actually identify, to first actually filter things that are hitting our network, and then actually identify different trends among different actors, different ports that are being targeted, different IP addresses that are actually impacting our network itself. The other things that we've done is we've actually moved the doorway to our network further away. So instead of directly dealing with a threat at the door of HHS, we've moved the door of HHS to Richmond, right? To allow us to deal with overwhelming data that's being thrown at our network, to degrade our ability to execute services. So those are the things that keep me awake at night, and those are some of the things that we've been doing to provide elastic scalability to actually defend ourselves. And I do think that the U.S. healthcare sector is a primary attack vector for any adversary.
So I want to park on that, what keeps you up at night. So we've heard for the last 2 days, legacy acquisition systems that slow down speed to buy. What can we do as the public or private sector to help you? What could the audience do?
Yeah, I mean, I think the industry partner community constantly asks for more communication, and I'm not saying don't ask for more communication. was the industry liaison for DHS. I know how important that is. But I think, we actually went and built a blockchain-enabled acquisition system that's a series of microservices that we used to negotiate the deal that I talked about earlier. I think it would be very helpful if the industry base started to talk about the fact that the administrative costs associated with doing business with the federal government, and you guys already talk about this, but submitting multiple RFIs, 1,000 RFIs for analytics if you're a large company alone just doing business with the Department of Health and Human Services, constantly resubmitting SAM information. If you started to press on the fact and ask government to actually create systems that are immutable in nature, that are specific to the industry partner, that automatically pull those data sets from the different systems that exist in the government, pre-populate them, pull up the last RFI that was submitted to an agency and provide that to you as an industry partner so that you can either work off that or just resubmit that again. Because that capability exists, we're actually rolling it out. It's called HHS Accelerate. Now, it has the neural network functioning off of it right now. We're rolling it out in January for the OCIO function within HHS, but pushing the acquisition function to actually use modern technologies to do that would be extremely helpful. And I do think a pivot from, in particular with the acquisition function, and I mean this, and I know this is almost heresy, but I do think a pivot from commercial off-the-shelf technology that facilitates the acquisition lifecycle to leveraging commercial platforms and a series of microservices that allows for data sharing across a large decentralized function like the acquisition function, but allows for customization at the execution layer when we talk about the series of microservices that can be built to facilitate the process, and then allows you to use some commercial off-the-shelf modules that may already exist for some of the more simplistic parts of the business process that are germane between agencies. I think industry has to communicate in one voice that that's how they want to do business, and we do a good job of asking for communication. We do a good job of talking about the administrative costs. We rarely talk about the fact that technology can actually solve that problem.
And the same thing at the CDC. What keeps you up at night, and how can we help you?
I think one of the things that I worry about is the sheer volume of data that not only what we're creating, but the data that's coming in for local and state health offices and these ministries of health from other countries. It really, we by ourselves cannot do the analytics, predictive or prescriptive on this data alone. So we do partner with the national labs and some of our local educational institutions, but we're also looking for partnerships in the private sector. As I stated before, some of these sequences are just a single run will put terabytes of data out there, and when you're doing multiple runs, we're lacking data scientists. There's a huge shortage, and I'm sure that's not a surprise to anybody. And so we really do have to partner where, an aging workforce on the whole, and a lot of baby boomers and some of our best scientists are eligible for retirement. So we're also looking at succession planning, and I think like a lot of federal agencies are probably having a difficult time attracting millennials and recent graduates into public health. And so for us, partnership is very, very important as we empower our future workforce. We want to attract the best we can, and when we can't, we really have to look at our contract vehicles and our partners to assist us. The sheer volume of computations that are required to do the epidemiology nowadays with all the data flowing in, it would be difficult for CDC or other agencies to really go it alone, so we're heavily dependent upon our partners.
All right, thank you. Dominic, same question.
Sure. I mean, I'd have to say hands down, just like when I was in the Department of Defense, what kept me up at night was the thought of losing one warfighter, one soldier because of a failure of IT. Same in the VA. Our clinicians rely so heavily on IT, and the information housed in our IT keeps me up at night thinking that possibly if IT fails, that data won't get where it needs to go and we lose even one veteran or harm them. So, you know, in terms of how you can help us, we in VA definitely have a buy-first approach mentality, cloud-first mentality. We really see our relationship with you all, with the vendor community, as a partnership, a strategic partnership. We talk with all of you a lot. We set up a deputy CIO for strategic sourcing, an entire office. We have a vendor management office under there, and that isn't there to just be a gatekeeper and to keep you out. It's quite the opposite. They're meant to get you in and get you in to talk to the people you need to talk to help us scrum and think about how we can help the veterans. And what we ask you to do is come to us and not just think about your technology and what it does in and of itself, but please think about, you know, what it can do to make a veteran's life better or save some lives, what you can do to partner with others to have a complementary offering that can really provide us a holistic solution, and even help us identify instances where you've helped other government entities with a similar problem and encourage us to partner with them and then maybe work with you through that partnership. There's a lot of opportunities for you all to help us, and we want your help. And I'll just mention one last thing. We have an open API initiative. We're really exploring some of the ways that you can help us by developing capabilities through APIs that you can just bring to market directly to the veterans that will tap into their data. We've done that recently through the Apple Health app, and now veterans are going to be able to access their veteran data through their Apple Watch and through their iPhones through the Health app. So that was bridged with an API. And we didn't have to contract with a vendor with Apple. They built the solution and then connected through the API. And we have a whole, if you look it up online, we have a whole open API initiative and an API pledge. And a lot of you have already signed up to join us in that effort. So things like that, you know, we really do appreciate your participation and what you offer.
All right, I think some other people have some questions for you, and so we're going to turn to the audience for a few questions. And I admit I cannot see you, so
The lights.
I could stand up and I probably still can't see you. But any questions from the audience for our panel here?
I can't see.
They want to see Scott.
None? I'm going to have to call on somebody. It must be late in the day. All right, I've got a great idea. Aha, we have a taker.
Yeah, I mean, we reach out to our agency partners a lot, actually, with VA. The big elephant in the living room will be the electronic health record modernization. We're partnering with DoD. We're implementing Cerner as the new VA electronic health record, replacing a 40-year-old system with 130 instances, unique instances all over the network. And the interesting thing about that is it's not just a partnership, it's one environment. We're going to have one instance of Cerner that we're both going to share. So all of our data is going to be commingled into one data environment. And this is what's going to finally get us to a longitudinal health record for our service members from boot camp to benefits. So like Jim said earlier, they're never going to have to submit their forms when they leave active duty military. It's just going to follow them through life. So that's a great example of how we're partnering. We're working through the policy issues. We're working through any kind of issues that come up, and we're succeeding. So, and there's many examples of that.
And I think we have a large electronic healthcare modernization effort underway in IHS, and we're actively looking to partner with DoD as well as VA, and had the conversations with DoD, but have not had the conversations with VA yet on how we can benefit from the work that they've already done. Our effort is a little bit different in the fact that every Native American tribe sees them, they're a sovereign nation, and they have different rules, which makes it a little more complex in terms of implementation, but there's a lot of lessons learned, and also on some of the data sharing exercises related to contracting data. and opioid data. We are working with some state and local governments for opioids perspective, and we are working with at least 2 other agencies to ingest their contracting data. I do want to take 30 seconds and just say the one thing that industry can help us with related to artificial intelligence is data tagging. You guys don't talk about it at all. Data labeling, you don't talk about it at all. But the ability to actually label data rapidly at a very low cost is what's going to make artificial intelligence work or not. And agencies aren't talking about that enough, and they're not doing it. If you go to China right now, they have very cheap labor, and all they do all day long is label data. And they have very efficient mechanisms that where one person just sits there and looks at a million pictures over 6 hours, and their job is just to click on the nose of a person in a picture, so their facial recognition artificial intelligence can develop. We don't talk about that at all in the federal space, and that's the difference between maintaining our lead in artificial intelligence and not, and that's also why Uber and Lyft drivers get paid so little. What they are doing is labeling data at a very low cost for those 2 entities who are building actually artificial intelligence. So that's just one other thing that I think this group really needs to help us with, because nobody's talking about it, and it's the difference between developing efficient microchips for machine learning capabilities, for artificial intelligence, and developing the infrastructure that will power artificial intelligence in the future.
And just to add to what Jose is saying, one of the things we need to tackle is data sharing agreements. So within the department, that's already underway, and we have huge amounts of data lakes. Really, a lot of the old data sets are commingled with PII and PHI. But the data sharing agreements will actually facilitate and go a long way towards collaboration. And also, the data sharing agreements need to extend to the private sector as well. And I know that dealing with Europe with GDPR, is an issue. But if we can start off with our federal agencies here with a kind of a unified, holistic approach for data sharing, that'll go towards a long way, not only within the federal agencies, right, but as we develop these data sharing agreements with the private sector, this is where our partners then really could add value to solving some of our problems.
Final thoughts?
Yeah, I'm excited about the future. I mean, I just see so much opportunity here with data and AI and analytics. I just want to get there, so ready to go.
All right, I think we've run up on our time here, and I just want to thank you, gentlemen, for coming and spending some time with us. Thank you for your 64 collective years of public service. And I think the audience agree that you guys did an outstanding job, and we'll wrap it up. Thank you very much. Well done.